This talk is about how to express empathy. In this talk, I'll review the definition of empathy, practical applications of empathy in psychiatry and psychotherapy, and how to use verbal and nonverbal expressions of empathy. Basically, empathy is the ability to recognize and relate to others' thoughts and emotions. Let's break down what this means. First off, there are both cognitive and emotional aspects to empathy. The cognitive aspect involves understanding another person's perspective in an intellectual, rational manner. It involves perspective taking, or being able to put yourself in the other person's shoes. The emotional aspect involves emotionally resonating with another person's feelings. In other words, being able to actually feel what the other person is feeling. Being able to express empathy effectively is a skill and can be used to help people struggling with mental health problems. Before we discuss how to express empathy, let's discuss how empathy can help people. Firstly, it can help people to cope with difficult thoughts, emotions, and experiences. This is the basis of a form of psychotherapy called supportive therapy. In this form of therapy, expressions of empathy help a patient to feel heard and understood, which is therapeutic in itself. Secondly, expressing empathy helps to build a strong therapeutic alliance. In psychodynamic therapy in particular, this helps the patient to feel more comfortable opening up to free association, and allows the therapist to offer deeper and more helpful interpretations over time. Finally, and perhaps most importantly, it is one of the common factors in therapy. In brief, the common factors are the factors across all forms of psychotherapy that contribute the most to the overall effectiveness of the therapy. Numerous studies have shown that, regardless of the type of therapy, whether it's psychodynamic therapy, CBT, DBT, or something else, these common factors, such as empathy, are strong predictors of whether the therapy will be effective or not. Now that we understand the motivation for expressing empathy in psychiatric practice, let's move on to discuss how to express empathy. Basically, there are two ways in which empathy can be expressed: verbally and non-verbally. Empathy is expressed verbally through verbal responses to the patient that show that you understand what they are thinking and feeling. To better understand this concept, it's helpful to know about Carkhuff's 5 levels of responding. This is a framework for rating how well a therapist's responses show that they understand the meaning of what a patient is saying. The lowest level is ignoring, which involves completely missing the meaning of what the patient has said. Maybe the patient has just shared something troubling, for example, that their significant other missed their birthday party, and the therapist completely ignores this, moving on to ask about a different topic. The second level is attempting, which involves an attempt to respond, but ends up missing the message the patient was trying to convey. For example, for the patient whose partner missed their birthday, the patient was likely trying to convey disappointment about their partner, but the therapist responds, "How many presents did you get?" rather than responding to the point about the patient's partner. The third level is responding to the explicit, stated message of what the patient has shared, but missing underlying implicit meanings. Using the same example, this might involve saying something like, "It must have been hard for him not to be there." This is an empathetic response and involves taking the patient's perspective, but you can see that it is also fairly superficial. The fourth level is responding to the implicit, deeper message of what the patient has said. Again, using the birthday example, this might involve responding to the patient's feelings of chronic disappointment with the partner, saying something like, "So this is another example of him disappointing you." You can see that this involves knowing more about the patient and requires a deeper and longer relationship. The highest level of responding is expanding upon what the patient has said. This involves both responding to the deeper message the patient has shared, as in level 4, but also adding on to what the patient has meant. So, it might involve saying something like, "So this is another example of him disappointing you, and I wonder if this reminds you of when your dad didn't show up to your soccer games." In this case, by knowing the patient's history and internal world deeply, the therapist has made an insightful inference that could help the patient to understand their relationships better. In general, when I'm working with a patient in therapy, I try to make most of my responses at level 3 or above. Anything below that could weaken your therapeutic alliance over time, as the patient will not feel heard and understood. Let's move on to nonverbal expressions of empathy. These are any expressions of empathy conveyed through body language. Essentially, nonverbal empathy involves mirroring the patient, that is, moving and speaking in the same way as your patient. This involves a few components. Motor synchrony involves moving in the same way as your patient. If they are sitting down, you sit down. If they lean forward, you lean forward. If they cross their legs, you cross your legs. This is a bit of an exaggeration, but basically you want to be in the same posture as your patient. These reciprocal movements help put you in the same feeling state as your patient. The second part is vocal synchrony. This involves using the same vocal tone, pace, and rhythm as your patient. For example, depressed patients tend to speak slowly and softly, with little variation in their vocal pitch over time. To match your patient and meet them in their depression, you should vary your own voice accordingly. You should even try to use similar vocabulary and pronunciation as your patient, in a process called lexical alignment. Those are the major points of this talk. So, to summarize, empathy is the ability to recognize and relate to others' thoughts and emotions. Empathy involves both intellectual understanding and emotional resonance. Verbal empathy is conveyed through responding to the deeper meanings of what a patient has said. And nonverbal empathy is conveyed through mirroring a patient's movements and speech. I think there's a lot more to be said about how to develop empathy, the uses of empathy, and so on, but hopefully this is a useful framework and starting place. That's all for this talk. Thanks, and see you next time.